Hello everyone, my name is Marcela Forgerini and today I will present the study title. There is no additive interaction between the SNP 1799983 and the use of low-dose aspirin in the risk of gastrointestinal bleeding, wrote by me, Gustavo Urbano, Thales Rubens de Nadai, and Patrícia de Carvalho Mastroianni. First of all, I would like to comment briefly about our research topic. Among the low-dose aspirin users, we can observe some patients experience some adverse drug reactions due to idiosyncratic responses, such as upper gastrointestinal bleeding. And in this context, some studies have been reporting the influence of genetic variants in this risk. And in our previous study, we observed the influence of genetic variants in the gene NOS3 in the risk of upper gastrointestinal bleeding. This gene is involved in several physiological processes in our body, such as the aggregation, platelet aggregation. So we intended to assess the multiplicative and additive interaction between the presence of the SNP 1799983 and low-dose aspirin use in the occurrence of upper gastrointestinal bleeding. For this, we conduct a case control study approved by the Ethics and Research Committee of University of São Paulo and São Paulo State University. And this study was conducted in a Brazilian complex hospital, and we had two groups. The first is the study group composed by 200 participants with gastrointestinal bleeding diagnosis, and the second group, the control group, composed by 706 participants without any gastrointestinal problem. We collected the total blood of all these participants, extracted the DNA and quantified this DNA. Using this DNA, we conduct the genotyping of this SNP, and in this figure, we can observe the allelic discrimination of this SNP and the alleles G and T. The data of this study was collected through interviews, and the data was entered in the database Research Electronic Data Capture, or REDCap, and we assessed the Hard-Weinberg equilibrium, and this SNP attained this equilibrium. And to assess the multiplicative and additive interaction, to assess the synergism index and relative excess risk due to interaction, HARRY, we conduct regression models adjusted by the following variables: history of ulcer, bleeding, dyspepsia, cardiovascular disease, cholesterol, Helicobacter pylori infection, no steroidal inflammatory drugs and anticoagulants use, and alcohol and tobacco ingestion. As results, we can observe in the Table 1 the multiplicative interaction between the use of low-dose aspirin and the presence of the genetic variant of this SNP, and we can observe that the carriers of the genetic variation in use of low-dose aspirin had increased gastrointestinal bleeding. However, when we observe the presence of additive interaction, that is a biological interaction in this risk, we didn't observe an increased risk of upper gastrointestinal bleeding in these participants. So, as a conclusion, our data evidence no additive interaction, that is, no joint biological action between the genetic variation assessed and low-dose aspirin in upper gastrointestinal bleeding. And I want to thank you for your attention and the following fundings: FAPESP, CNPq, CAPES, São Paulo State University, and ProEx. Thank you.